All right, we're here with Paul Thomas, an infection preventionist with Ministry Healthcare. And Paul, obviously the flu season, as usual this year, is off to a full swing and much maybe quicker than years past, and it looks like there's just a lot of reported flu cases out there. Can you just talk kind of in general where we're at right now as of the first week of January here with the flu season?
Yeah, starting about Christmas Eve in our community, we started to see more influenza or the flu. Now, influenza is the respiratory flu. It's not the nausea, vomiting like the stomach flu. It's the high fever, the muscle aches, the general tiredness where you know that you're sick and you know you have to be in bed for a few days. We saw more cases starting on Christmas Eve, as it historically does. It's really ramped up to where we're seeing a lot of influenza patients.
I know, in the kind of months of the fall here, we've been ramping up, obviously, as the flu shot, the best first line of defense for things. I know there's been a lot of questions about the reliability of the flu vaccine this year, but still awfully important for people to get a flu shot to protect themselves, right?
It certainly is. The vaccine is something that we can do to prevent influenza. Influenza is a virus, and there's not many antiviral medications. And antiviral medications can be taken after you've developed the virus disease, flu disease. So vaccine is the preventable. There's a lot of science behind the flu vaccine. They use the most disease-causing virus strains of last year in this year's vaccine. So there is some science that goes into it. It's a calculated guess on what the next year's flu diseases are going to be as far as the pathogenic or disease-causing viruses.
Obviously, with as many cases as we have, there's a lot of hospitalizations, there's a lot of people seeking Medicare. Facilities throughout central and northern Wisconsin, gotta believe over the next couple of weeks, are going to be adjusting some of their normal operating procedures. Because of that, that may include restricting visitors, and setting new policies in place for things like that. It's all designed to protect not only people, but healthcare workers also. Is that correct?
Absolutely. We want to provide top quality patient care. If we have a lot of flu cases and we need a lot of healthcare providers to care for those patients, we may alter services in that we want to provide the best care to our flu patients.
Yeah, obviously. So if you have hospitalized, someone you know that is hospitalized, a couple good rules of thumb I would have to guess would include, if you're sick or have symptoms, please don't consider coming into a hospital for a visit, just not a good time. What else would you tell folks that are out there to maybe just brushing up and know what the status of their facility is? Would that be good? Yeah.
And you have to think of your loved one that's hospitalized. Yeah. They're already in the hospital with some other disease. It could be influenza, it could be another medical issue. You don't want to come visit them when you're ill and maybe give them an infection. Obviously, for yourself, getting the vaccine, hand sanitization, coming into the hospital, we have the alcohol hand sanitizers at the doors, we have them in the rooms. So you're protecting yourself, because once your loved one gets well and goes home, you're going to be responsible for assisting them, and we want you to be as healthy and strong as you are.
Key for people to observe that hand hygiene, obviously, if you're going from room to room, touching doorknobs, things like that, and just it doesn't hurt to, as part of your routine, to keep these things at bay. Wash your hands regularly. How often should folks consider doing that?
Yeah. Hand washing is key. Yeah. When your conscience is dictating that you've touched something that may not be the cleanest environment, it's a great opportunity. Before you eat, after using the restroom, before food preparation, a lot of the hallmarks for hand hygiene. Yeah. Hospitals, when you think of hospitals, you think of what we are. We invite the sickest people in the community to come and visit for short terms, or sometimes longer than short times. So that would be another risk, that we won't want to introduce anything to the patients in the hospital. That's why you see nurses and physicians and other healthcare providers being really diligent, going into the room, cleaning their hands so they don't bring anything to the patient. Coming out of the room, cleaning their hands so they don't take anything to the next patient they see.
I would think also, obviously, if you're not feeling well, staying at home or keeping your child at home from school or whatever until they are healthy goes a long way in keeping these germs contained, right?
Yeah, kids tend to have a talent of being ill. Yeah. That's just part of growing up and developing the antibodies. And influenza is kind of tricky in that you can be infectious, contagious before you show symptoms, up to 24 hours or greater. So even though you're feeling well, you could still pass on the influenza. Obviously, if you're ill, we want you to stay home, take care of yourself, get over your illness before you do some of those extra things like visiting patients in the hospital.
So, proper hand hygiene, cover your cough, stay home if you're not feeling well, and not too late to get a flu shot are our important messages here today. Right?
That's right. The flu shot is something proactive you can do to help prevent the disease.
Okay, Paul, thank you.
Thanks.